According to one representatives of the victims' families, they reject the notion that former Gauteng Health MEC Qedane Mahlangu was unaware that the patients would die. Advocate Adila Hassim has stated that Mahlangu had been cautioned prior to making the decision to terminate the contract with Life Esidimeni. In fact, the former MEC allegedly informed victims' families that if they wanted their family members to remain at Life Esidimeni, they would have to pay for it themselves. Advocate Hassim also argued that, as an expert, Dr. Manamela should have been aware of the risks involved in transferring patients out of Life Esidimeni.
Ms. Mahlangu made the decision. Although she tries to characterize this as a collective decision of the Premier Budget Council, the evidence is to the contrary. We submit that the evidence by Minister Creasy and the Premier at the time, Mr. Makura, is more probable. In fact, Minister Creasy in this inquest stressed again that there was no instruction at all to cut healthcare services.
Furthermore, the representatives of the families argued that Precious Angels owner Ethel Ncube may not have directly interacted with each individual mental health care user, but she had dealt with the health department since the beginning. She was responsible for Precious Angels and employed individuals who were not adequately trained and supervised.
There was a former employee of Precious Angels. He was originally a cleaner, and then Ms. Ncube asked him to come and care for patients. Because he had apparently had an elderly relative that he cared for at home. He had no training. He said in his evidence that he was promised training on how to take care of mental health care patients because it was not something he knew how to do, and it did not come. He talked about staff enduring extended shifts without any days off, not being paid, and he talked about the fact that because of those conditions, those working conditions, many staff left. So there was a turnover of staff.
Advocate Phyllis Foster from AfriForum praised Section 27 in the South African Depression and Anxiety Group, describing them as the true advocates for the people.
We have to pause and comment at this stage the role played by SADAG and Section 27. They must be commended as the real lawyer for the people. It is common cause that the result of their fears that has already been brought to the attention of the Department of Health on the 20th of October 2015 did indeed materialize.
The inquest resumes on Friday. SABC News, Johannesburg.